If you have tinnitus and you've been to the internet for answers, and we all know you have, you've almost certainly come across the supplements, Ginkgo biloba, zinc, magnesium, vitamin B12, lipoflavonoid. Maybe you've tried one. Maybe you've tried all of them. Today, I want to give you the honest answers that your doctor probably didn't take the time to give you. What does the research actually say about these supplements? Do any of them work? And if not, what does? Hello, friends. I'm Dr. Maria Morrison. I'm an audiologist with 18 years of experience specializing in tinnitus management. I have tinnitus myself, and I'm not here to sell you supplements. I'm here to give you the truth. Don't forget to hit that subscribe button. I post a new video every week. I want to start here because I think it's important. When you get the tinnitus diagnosis, most people are told one of two things: either that nothing can be done or that you just have to learn to live with it. Both of these responses leave people feeling hopeless and looking for anything that might help. Supplements feel appealing for a few reasons. They're accessible. You can buy them without a prescription. They feel natural and low risk, and the marketing around them is designed specifically for people who are desperate and haven't been given better options. I'm not judging anyone who has tried them. I understand why. But I want you to have accurate information so you can make the best decision for yourself. Let's go through some of the most common ones. First is Ginkgo biloba. This is the most studied supplement for tinnitus and also the most overhyped. The theory is that Ginkgo improves blood flow to the inner ear and the brain, which might reduce tinnitus. The reality, multiple large, well-designed, randomized controlled trials, including a Cochrane review, have found no significant benefit of Ginkgo biloba over placebo for tinnitus. It does not work as a tinnitus treatment. There is one exception worth noticing. If your tinnitus is caused specifically by blood flow issues, a physician might have a clinical reason for considering it. But for the vast majority of patients with tinnitus, Ginkgo biloba is not going to be the answer. Zinc. Zinc deficiency has been associated with hearing loss and possibly tinnitus in some studies. The theory is that if you're deficient, supplementing might help. The evidence is mixed and weak. Some studies show a small effect in people who were genuinely zinc deficient. Most studies show no effect in people with normal zinc levels. If you're eating a reasonably balanced diet, zinc supplementation is unlikely to make a difference for your tinnitus. Magnesium. Magnesium is interesting because it does play a role in protecting the hair cells of the inner ear from noise-induced damage. Now, some research suggests it may help prevent noise-induced hearing loss if taken before noise exposure. But for existing tinnitus, the evidence is very limited. There's no strong clinical trials showing that magnesium supplements reduce tinnitus in people who already have it. That said, magnesium is generally safe, and many people are mildly deficient, so it's a low-risk supplement. Just don't expect it to be a solution. Vitamin B12. B12 deficiency can cause neurological symptoms, and there is some research linking B12 deficiency to tinnitus. If you are genuinely B12 deficient, which is common in older adults and people on certain medications, correcting that deficiency may have benefit, including potentially for tinnitus. But again, if you're not deficient, supplementing with B12 is unlikely to change your tinnitus. Get your levels checked by your doctor before spending money on this. Lipoflavonoid. This is marketed specifically for tinnitus in a very aggressive way. The active ingredient is essentially a form of vitamin C and B vitamins. The evidence base for lipoflavonoid in tinnitus is extremely thin. We're talking about small, old studies with serious methodological problems. There is no high-quality evidence that lipoflavonoid reduces tinnitus. If you step back and look at all of this research together, a pattern emerges. Supplements that address a specific nutritional deficiency, B12, zinc, magnesium, may have modest benefits for people who are actually deficient. That's essentially treating an underlying issue, not treating tinnitus itself. For everyone else, No supplement has shown in high-quality research to meaningfully reduce tinnitus. This is not because tinnitus is untreatable. It's because tinnitus is primarily a brain response, a neural processing issue, not a deficiency of a nutrient, and supplements don't retrain the brain. The most effective treatment we have for tinnitus work at the level of the nervous system. Tinnitus retraining therapy, cognitive behavioral therapy adapted for tinnitus, sound therapy, and brain-based habituation training. These are the interventions with the strongest evidence base. When a patient comes to me and says, I've tried everything, I've spent hundreds, thousands of dollars on supplements and nothing is working, here's what I tell them. First, you haven't failed. The supplements failed you. That's not your fault. Second, tinnitus can be managed, not cured. I want to be honest with you about that. But the distress, the sleep disruption, the inability to focus, all of those are absolutely improvable. I've seen it happen with hundreds of patients. Third, the path forward is brain retraining. Teaching your nervous system to reclassify the signal from threatening to neutral, that takes time and the right framework, but it works. I made this video because I believe you deserve the truth, not another supplement ad. If you want to understand how tinnitus actually works in the brain and what you can do about it, I have a free starter guide in the description. It's the starting point for everything I teach. And if you're ready for the full program, Rewire is my 8-module course that walks you through the brain retraining process, step by step, sleep, focus, sound therapy, stress management, and more. Now drop a comment below. Have you tried a supplement for tinnitus? Did it help? I read every single comment. Subscribe, and I'll see you next week. Bye, friends.